So there's a lot of confusion among patients and the general public about what is a bulging disc or a herniated disc. I get that question a lot from patients, but really there's not any difference, no significant difference. There are about 5 or 6 different terms that we use interchangeably. Bulging, protruding, herniated, ruptured, those are several examples of terms that just mean the disc is sticking out where it's not supposed to be. When a disc sticks out where it's not supposed to be, oftentimes it will contact or compress a nerve. That's commonly referred to as a pinched nerve, which often leads to sciatic type pain. Sciatic pain is pain that starts typically in the back and then radiates down into the hip, leg, and sometimes foot. So, if a patient has one of these conditions and has sciatica due to a pinched nerve, there are a number of different possible treatments for that. Not everyone that comes in actually needs to go straight to surgery for a problem like this. So options would include things like physical therapy, heat, ice, sometimes traction can be helpful, where you stretch the spine out to try to get the pressure off. There are a number of different medications that can be helpful, including anti-inflammatories, muscle relaxers, pain medications. There are some medications used for nerve pain like gabapentin, Lyrica, or Cymbalta. So a number of choices there. And then there are also several types of injections that can be used, commonly epidural injections, and those are procedures that are typically done by our pain management specialists. If a patient continues to have pain and problems through all those different treatments, then surgery is probably then an option. So when surgery is necessary, we try when it's possible to use the minimally invasive surgical techniques. Most of the time there's a minimally invasive option, which is great. Occasionally there's not a minimally invasive option, in which case we still have those open techniques to fall back on, and patients still can do well and get better from those. So if you are having symptoms from a protruding disc, sciatic pain, back pain, please contact our office to see how we can help you.